Hi, my name is Nolan. I'm the registered respiratory therapist here working for Dr. Mark's clinic. I am here for doing a demonstrational and educational video about pulmonary function test. So we are going to do the bare minimum of each test, but I will be explaining exactly what we're doing and exactly what each test involves. So the whole test for a pulmonary function test, the reason why you might need it is for anybody who has any type of pulmonary issues, such as shortness of breath or COPD or just people who can't breathe in general or who need to try to figure out what's going on pulmonary wise. It'd be best for them to do a breathing test or a pulmonary function test to see what's going on exactly. So I already put in my patient's information. So based on, I already put in her information. I'm not going to share her information to protect her. But a patient what we need for a pulmonary function test is 4 things. It's going to be height, ethnicity, sex, and age. Those 4 things actually are based on what the results that we get, the percentage that we get, and everything. It's based on what we can get. It can change the size of your lungs, and that's why we need it. So all those 4 categories are important in what we do. So let's get started. The first test that we're doing, we're looking at speed and volume. So how fast can a patient blow out and how much can they blow out until they're completely empty. So what they're gonna do is they're gonna start breathing normal. Then when I ask her, she's gonna take a big deep breath in, she's gonna go, let me see now, blast it out. And I want her to force it out like she's blowing birthday candles out 30 feet away. And sometimes this is really hard on certain patients because they really don't like being uncomfortable, but they really got to get out as much as they possibly can so we can see the total amount of volume that they have in their lungs. So once I see that she's completely empty, I will let her know when to take a big deep breath in, and that will be 1. So right now I am putting on a filter for her that protects her and the machine from germs and whatnot. Alright, you ready? A nice tight seal of your lips. Here we go. Start breathing normal. Big deep breath in. Blast it out. Push, 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 push. Don't stop. You're doing great. Keep going, keep going, keep going. Deep breath in. Okay. So the patient actually did pretty well. So for this test for spirometry, it's called spirometry, we're looking at, like I said, about volume and speed. So depending on a patient's speed, we can see how obstructed they are. Those are going to be like COPDers, people with emphysema, asthma, chronic bronchitis, stuff like that, bronchiectasis. So what we're doing for that is we're seeing the speed. So we need to get them to be at a certain speed. If they're too slow, there's obstruction, we might need to do a bronchodilator. For this purpose right now, our patient was completely fine. She doesn't need a bronchodilator that's such as like albuterol or the ones that are in the movies, like an inhaler. That's what it does. So a bronchodilator helps relaxes the smooth airway muscles in the airway, making it a little easier to breathe. So for right now, her speed was actually pretty good. So we're also looking at the volume. So volume will let us know about restriction, meaning her lungs aren't as big as they should be. So the capacity, a little bit of the capacity. So her capacity was good as well. So when volume is low, it could be obesity, it could be interstitial lung disease, like for people who have post-COVID, who've had COVID for a while, and they have scarring on the tissues of the lungs. So that can actually cause restriction as well, meaning they can't get as much as volume as they used to. So just for again, this is educational. We had to do 3 of these tests today. So a normal pulmonary function test takes about 30 to 45 minutes. We're not going to do all 3 of this test, but that was just one demonstration of what we got to do. So this certain test we can actually do up to 8. So if she would have kept messing up, or if a patient keeps messing up, we have to do it again until we at least get 3 almost identical tests that are acceptable and reproducible. So we will be moving on to the next test. So this next test that we're doing, so I'm calibrating right now. She's just gonna start breathing normal. I'm gonna ask for her to take a big deep breath in. She takes that as big as she can. So I'm gonna say let it out, breathe out all the way. So it's not as hard and fast as we did for the first test, but still faster than normal. When she's completely empty, I will let her know when. I'm gonna say take a big deep breath in. She's gonna go, and then she's gonna hold it. She's gonna hold it for about 10 seconds. I will give her a countdown. After the 10 seconds, she's gonna breathe out, just nice and easy. And that'll be 1. So for this particular test, what we're looking for is her diffusion capacity and how much can she absorb or diffuse the gases that we're breathing in currently right now. So basically, how much air can she get to her toes, or to her toes, her fingers, her ears, everything like that. So basically, what we're actually giving her, the gas that we're giving her, is actually a mixture of everything we're breathing in right now, but the main component is actually carbon monoxide. The reason why is for the chemistry people, the hemoglobin absorbs it really, really quick. So that's how we're able to get an accurate result within those 10 seconds. And so when we're breathing out, we're actually able to see how much she absorbs. So we want the body to absorb it really well. If your body doesn't absorb it, we're going to be able to detect if she breathes it out at the very end. If she breathes out the gas that we just gave her, she didn't absorb it that well. That means her the gases that are going across the membranes and everything like that, it's not that good. It's, again, we're seeing how well she's able to absorb it. There we go. Breathe normal. Deep breath in. All the way out. Faster. All the way. Faster, faster. Almost there. Keep going, keep going, keep going. Deep breath in as big as you can. All the way. Hold it right there. In. 8, 7, 6, 5, 4, 3, 2, 1. Breathe out. All the way, all the way, all the way, all the way. Good job. Take that one off. Okay, so for this one, she also did it well as the first one. So with this test, we can actually do a maximum of 5. For this one, we actually need 2 almost identical tests that are, again, reproducible and acceptable. So she has to breathe in, take a deep breath in at over 90% of her vital capacity or her inspiratory capacity. And that is to make sure that she is able to take that big deep breath in and actually absorb it pretty well. Because if she doesn't take as much as she can, then it can actually show less than what she's actually able to do. So why this is also important is, or what I'm going to next is we can only do a maximum of 5. And the reason why is because even though the hemoglobin absorbs it pretty well, the first time it takes a while to actually breathe it out all the way. So actually how well the gas is able to get outside the lungs. So that is why people on fires and whatnot, that's why they can have carbon monoxide poisoning, because they're able to absorb it really quick and it stays in their body. But that's why they need to go to the ER as soon as they can to get a bunch of oxygen to flush it out as much as they can. So in this case, we're only going to do one again because it's an educational video, but I will be doing a second one, and we would have to at least wait 4 minutes to be able to do a second one to actually get an accurate result. So we'll move on to the third test. Okay. The third test that we're going to do, we are looking at her total lung capacity and also her airway resistance. So her airway resistance is all the tissues and stuff that she has to go through. Total lung capacity is just how much air are in both of these lungs and how much can she actually get to. So this one we're able to look at if she's air trapping, is if she's actually has a lot more air than she can actually blow out, or if she's actually doing pretty fine when it comes to that. So what we're doing here, this whole machine that we have is, it's called a body box. It's called a plethysmography box. So when I close this door, we're actually using a science law called Boyle's law, which is based on temperature and pressure. So based on that, we're going to be able to create a pressure in there. And what it's going to do is be able to give us a better estimate of the residual volume that we have. And in doing so, we'll be able to find out the total lung capacity that we do have. So what she's gonna do is she's gonna start breathing normal. Once I get that, we're getting her tidal volume. So when she breathes out all the way to her empty, that's gonna be her expiratory residual volume. Once I see that she's empty, I'm gonna tell her to take a big deep breath in. That's gonna be her vital capacity. Then she's gonna go back to normal breathing. And once she goes back to normal breathing, I'll let her know when. She's gonna put her hands to her cheeks and she's gonna do small and fast breathing. So just like this. So what we're getting right there is her airway resistance. We're seeing how much does she have to go through with all the tissues and all the stuff to actually get to the lungs. After 6 seconds, it's gonna block off. It'll feel like it's breathing against a wall, or my hand's completely occluding the hole. So the whole purpose behind that is that's where we're actually creating the pressure, and doing so that's how we're able to find the residual volume. So not everybody is this test easy for. There is a second test that we can do, which is called the nitrogen washout. It would be the same thing, but what we're doing is we're actually giving a bunch of oxygen, flushing out the nitrogen in the lungs, and getting an estimate. But what we're going to do is the more accurate way to get the lung volumes. So that's what we're going to do. I'm going to demonstrate here. I'll guide you the whole way. Close the door. Here we go. Start breathing normal. Now breathe out all the way. As much as you can. Don't stop, don't stop, don't stop, don't stop. We're almost there. Keep going. Deep breath in. Breathe in. Back to normal. Hands against your cheeks. Here we go. Follow me. You're doing great. Keep it up, keep it up, keep it up, keep it up, keep it up. Here it comes. In and out. You're doing great. Keep it up, keep it up. Good job. Okay, you take it out of your mouth, take it off your nose. So with this test, we would actually have to get two almost, again, acceptable and reproducible results. So with all these tests, again, they all need to be acceptable and reproducible. So they're all time consuming. So each one should take about 30 to 45 minutes. So that's based on American Thoracic Society guidelines. So for this, again, I could also be able to tell her if she were to be air trapping, that would also kind of be a hint to give her that bronchodilator that I was talking about, which would be albuterol, Xopenex, Duoneb, Atrovent, something like that, to be able to open up her airways. As of right now, the patient does not need to bronchodilator based on the results that I have seen. So this is the bare minimum pulmonary function test. There are more tests that we can do, such as MVVs, which is maximum volume ventilation, or MITs and MEPs, which would be able to tell about muscle strength, about inhalation and exhalation muscle strength. So how hard can you suck and blow? That would be more of a neuro patients. That would be more of stroke patients or muscular dystrophy. The MVVs would be more of how much can they actually breathe during exercise, or how much can they actually, if they have any problems with breathing during exercise or extraneous activity. There's also 6-minute walks that we can do. That one looks at oxygen. That one looks at heart rate. That one looks at blood pressure. We're also looking at the quality of life. So how many feet or meters can they walk in 6 minutes? There's MVO2s, which we can put them on a treadmill or a bicycle, which would actually look at how much carbon dioxide and how much oxygen are they sucking in and blowing out during that exercise test. But for this this video here, that was just for spirometry, DLCO, and lung volumes. This is the bare minimum that we can do for a pulmonary function test. And that is it.